everyone, welcome back to Fruit in the Abide with Brittany. I know it's been a minute since I posted and made a new video, and it's been even longer since I've made an update video regarding the tibial sesamoid bone removal surgery that I had almost exactly 5 years ago. So on July 2023, 2025, it will be exactly 5 years since I had that surgery. And so I really want to apologize for not documenting, being consistent, and not being really a good steward over documenting my progress over these past 4.5 years. But today I'm here with an update video and a question and answer video. I have received some questions in my comments, and I just, again, sincerely apologize for the delay of just letting you guys know how I'm doing. This video will kind of be a little bit similar to the video that I've done 6 months post-op, which is the last update video that I've done, and a lot has changed since then. So I will first do the Q&A, and then I will go into giving an update on the strength, flexibility, balance, activity tolerance, pain, swelling, mental health, all those different things that I did in 6 months post-op. So yeah, without further ado, let us get started. All right, so just to give you guys some background, if you haven't seen my other foot recovery videos or about the surgery, I had a tibial sesamoid bone removal surgery on my right foot on July 23rd of 2020. So almost exactly 5 years ago, I had the surgery. And I had a fracture in my sesamoid bone that wasn't healing through conservative measures. I was in a boot for about 7 to 8 months, and I had a lot of swelling, a lot of pain, a lot of stiffness, just everything that led to me getting this surgery. And if you guys would like, you can go back to my other videos to see how the surgery went. Like the day of surgery, I shared about the day of surgery, and I shared like 2 weeks post-op up until like 6 months post-op. Hopefully this video, my prayer is, will serve as hope because I'm not where I used to be. I can't say that I'm 100% of where I want to be, but by the grace of God, I am so much better. Now that I'm further along in my recovery, I have returned to doing things that I enjoy doing and able to do them for the most part without significant pain. And I'll get into that as I go through just the different. Okay, so let's get into the questions that I received. Again, they're not in like a real particular order, and I'm looking down. It's been a while. Please bear with me. I'm looking down in my notes, and just so make sure I don't miss any questions. And if you do have any questions that were not answered, please feel free to put it in the comments, or you can email me. I will leave my email in the description box below, and I will look at the comments and look at the questions. And if it's a lot of questions, I will make another video to answer those questions, or I will try to respond back to the comments. Okay, so the first question is, how are things going for you with your surgery and recovery? So things are going really well for me. I have to say it's going really well. If I had to give a number on how recovered I am, like saying 0% is like no recovery, like I'm basically at the same place where I had my surgery. I'm in the same amount of pain, same swelling, can't do things. That's 0% to 100% being fully recovered and basically back at my baseline doing things that I've done before the surgery. If I had to give it a number, I will say that I'm about 85% recovered. Again, this is like 5 years later, and I want to be as honest as I can with you guys, as transparent as I can, because yeah, I just want to be as honest as transparent. I wouldn't say that I'm 100%, but if I had to give a number, I will give it 85%. On my day-to-day kind of normal activity, I really don't have pain in that foot, but the reason I say 85% is because I do have flare-ups of pain, if that makes sense. So like right now I'm good, I could do what I gotta do. Today I feel good. My foot feels my foot feels okay. Like if I wanted to go for a walk, I could go for a walk and I'm okay. If I had to work and everything like that, I'm okay. But I do have like flare ups of pain in that foot, and so that's why I said it's not like 100%. And the pain is not unbearable, it's more of like an achiness. I don't have sharp pain. I will occasionally may possibly get some kind of swelling. It depends on how much activity that I've done, or just depending, I might just get some kind of swelling, but it's rare that I get swelling. But I do get some achiness in that foot. And I also developed or sometimes develop a callus under my pinky toe. So I think that I'm still kind of like unknowingly compensating for the change that was made in my big toe, if that makes sense. I feel like I'm still compensating for it, not knowingly, that would cause me to get a callus on my pinky toe. And I don't know if you guys see my other videos, that was an issue that I had before, and when I asked the doctor about it and everything, they said it's because of like the compensation. I'm putting more pressure on that pinky toe. So like right now, and I'll try to insert like either a video or a picture of, I do have like a small callus under that pinky toe. Okay, so I wanted to show you guys, like, this is where I currently have a callus on under my um pinky toe, like in the ball of my foot, and this is kind of where it develops. I don't really develop like too much of a callus. It might be a little one, but like right here, but it usually be like my pinky, under my pinky toe. And like I said before, it's from the I believe from the compensation. Like maybe I'm putting more pressure on that side of my foot because a change has been made in the big toe, and like my brain is just, or my body is just compensating for, that change that has been made. But yeah, and this is an issue that I kind of had in the beginning also, and it's still there, but it's not giving me too much issues. Like I'm not having really any too much pain or anything right now. But what I would do with the callus is kind of like shave it down a bit. And when I would have pain, it would be, I don't know if this is a good angle, but be like kind of right here. When I do have flare up of pain, like in my big toe, the pain is kind of like along here sometimes, or sometimes I might have a flare up of pain like where the ball of my foot is. And like I said, thank God, by his grace, like it be flare ups that kind of resolve with conservative treatment. And yeah, so I just wanted to share that with you guys. And it's not nothing like too significant. It's not stopping my daily activity. It's not stopping my function of things that I need to do. So right now I'm pretty okay. I'm okay with it. But that is one thing that I just wanted to mention. So before the surgery, I'm still at the first question. Bear with me, guys. Still at the first question of why I'm 85%. So before the surgery, I worked as an occupational therapist. I worked in a hospital. It was inpatient. So I was on my feet a lot. And if you guys check out the 6-month post-op video, I said that I didn't think at 6 months post-op I would be able to return to the type of work that I did in my day-to-day. Like my foot just wasn't at that point where I would be able to return to that type of work that was like really active and on my feet a lot. So where I am today, I'm not currently working, but it's not because of my foot. It's not because of my foot. It's because I'm going back to school. But around a year, I'll say it took about over a year for me to feel comfortable. Like I felt like I was ready to return to that type of work where I would be kind of like constantly on my feet, like bending and squatting and transferring patients and doing all those things that I was doing before. It took about over a year. And so in I would say around like September-ish, October-ish of 2021 is when I felt ready that I can go back to work full time and not have like significant not have issues with my feet. But around that time, um up until the following year in 2022, I felt ready to work, and I'm kind of going off a little bit, but bear with me. I felt ready to work, so I was applying for jobs, and nothing was really like working out or coming through. But God is so strategic. And just the way that he does things. Like, I felt ready and I'm like, I need to work. But during that time, my aunt, my very, very close aunt, was sick. She was ill. And at that time, I was the only one that was not working. So I was able to be more available to help her during that time. And not saying that other family didn't help. Other family helped. It was just that during the hours that they would work, I was able to be with her during those hours that they worked. And so I helped be a caregiver for her. And that was up until she passed in April of 2022. And so in April of after that, I say I started probably aggressively like looking for work and jobs around probably like, I'm gonna say June, May and June of 2022. And so in July of 2022, that is when I actually started back working, and everything was fine so far. So I have not been to my surgeon or the podiatrist since, I will say, about a year post-op. So that kind of shows that I haven't had any significant, by the grace of God, haven't had any significant setbacks, thank you, Lord, that prevented me from returning to work. So that was a big thing that I was concerned about, being able to return to work. And the type of work that I did, I was still an occupational therapist, and I worked in a school, a special education school. So it wasn't as physically demanding as the hospital, but I still had to be on my feet, and I still had to be quick on my feet, right? Because you don't know what's gonna break off. You just don't know what to expect each day working in that kind of setting. So I was constantly like seeing clients, the kids and everything, constantly on my feet throughout the day, just doing things in a not as physically demanding as like squatting and all that. So I was able to do that fine, no issues. Didn't have to go back to the foot doctor because I was having issues. But I did have like just occasional flare-ups of pain, but it didn't hinder me from functioning. It didn't hinder me from doing the work that I needed to do. I was still able to go to work. I don't think I ever called out of work because I was having pain in my foot, if that makes sense. And then the last job that I had, I worked in outpatient neuro rehab, and that was a little bit more physically demanding than the school job, because of some of the clients needed more help, with neuro, with stroke, cerebral palsy, all those different type of things. They needed help with just more assistance. So I did have to do more transfers and just squatting and bending and pivoting, all those different kind of things to make sure the clients got what they need. And so I say all that to say that I am able to return to full-time work as the work that I did before that was like a bit physically demanding, and my foot didn't, like I said, I had flare-ups of pain in both jobs, but it didn't hinder me from going to work. And what I did for that, by the grace of God, like I might have a flare-up, but then it goes away, and I might just have to rest my feet when I get home, ice it if it's really aching me, or do calf stretches help with the ball of foot pain. And also just resting it, elevating it when I get home and stuff. And I took ibuprofen or Tylenol if it was really bothering me. But by the grace of God, the flare-ups have been temporary. It hasn't been significant that would make me be off my feet for a long time. So I hope that answered your question. I am about 85% recovered, and I'm able to exercise like I would, but I do find myself a little bit like still a little bit hesitant with just the high impact. And I really wasn't a high impact kind of person before the surgery, so it's not really limiting my participation in exercise. So I am able to exercise, do moderate impact exercise or low impact, as I would do moderate impact before my surgery. And I'm able to dance, but I have to be honest with you guys, like, I think I'm just nervous about well, I did liturgical dance in my church, and I really do want to return back to it, and I'm still praying and seeking God because I feel like he's leading me back into doing that. But just to be transparent with you guys, just that, and it gets into kind of like the mental health aspect of it, and kind of get into that possible fear of, oh, what if I hurt my foot again? What if I jump on it wrong? Or what if I, being barefoot as we would with liturgical dance when you dance at church. So that's one thing that I have not returned back to. Now, for my aunt's funeral, I did dance at her funeral, and I was barefoot. I did liturgical dance, and I did have a little achiness, but I was fine. Like, it didn't set me back. The achiness went away. Like I said, once I do what I need to do, and it goes away by the grace of God. Thank you, Lord. It goes away. And so the next question goes along with that. The first question, it says, are you recovered now? And I would consider myself to be recovered as much as I can be right now. So I want to be honest with you guys. I don't have full flexibility, full flexion in that big toe. And part of the reason is me because I was not consistent with really stretching that toe out and breaking up that scar tissue. So that's I guess a lesson that I learned, or I feel like that's on me, that I don't have full flexibility. I also kind of think that it's the way that the incision was laterally like placed along the toe that limited the flexibility, but also I was not consistent in stretching it out every day to gain full range of motion in that toe. So that's again why I also say not 100%. But other than that, I feel like the strength of that toe has gotten like a lot better as I'm able to do exercise. I'm able to go for, I think in the last video I said I was able to walk for like 30 minutes before I felt pain. Now I'm able to walk for like an hour, and even more than an hour. And the reason I stop is not because of the pain in my foot. Most times, I can't say it never happened, but majority of the time, or even more than a majority of the time, the reason I stop walking is because I'm tired. Or the reason I stop exercising is because I'm tired versus the pain in my foot. And like I said, if it is like high impact kind of things, I do notice like I might get an achiness, and that just shows me that I need to just rest it, and I might have done too much. But it resolves. It's not a lingering kind of achiness, if that makes sense. So I would say that I'm recovered as I can be. Not saying that I can't, not saying that I've reached my full potential. I think it's always something that we can do to try to reach more potential. Like, I could begin to stretch out that toe more. I could begin to do more strengthening exercises in that foot to really reach the full potential of it. But as for right now, function and participation is like just my mindset, and I guess that's kind of been my mindset all along. It's like, as long as I can function and do the things I need to do independently. And as long as I can participate in things that I enjoy doing, again, like I said, with the dance, it's a little bit of a different story with that. But with everything else, I'm able to exercise, I'm able to work, I'm able to do physical activities. Like if somebody invite me to like an exercise class or a walk or whatever it might be, I'm able to do it. And the next question, it kind of follow along with the previous questions. It says, how is your foot now? Has the bunion stabilized or gotten worse? Okay, you guys. So like I said, my foot is about 85%. It's not 100, y'all. I still have some flare-ups of pain, and I'm just being honest. But with the bunion, if you guys visited or checked out the other video that I had regarding I had a bunion. I developed a bunion after the surgery. And so I'm gonna say that it is stabilized. So the reason I say that is because I have not gotten surgery to correct the bunion. And for right now, not saying that now throughout these years of recovery, I have had pain in the bunion. But what I did was where the bunion was, I had pain where the bunion was. What I did was I use, you know, the bunion correctors that you can put in between your toes. They're kind of like spacers. And the days that I would have pain, and I suspected that it was coming from the area of the bunion, I would put the spacers in between my toes. I would put the socks on my feet. And if I was able, I would just like elevate it. I would just like rest it, right? But on the days that I had to be active and I was having pain in where the bunion was, I would wear it with my shoe. And the bunion corrector, or the spacer, especially the spacer in between my big toe and I guess the second toe, that really helped alleviated the pain. Like almost immediately alleviated the pain once I put it the bunion corrector in. Right now, I don't have any pain in where the bunion is, so I don't know if this is the right mindset, you guys. But for right now, in this season in my life, if it's not giving me pain or issues right now, I'm kind of not too concerned about it. And that's probably not the best way to think of it, but in this season in my life, it's a lot going on right now, and I'm just grateful to God that it's not giving me any issues, it's not giving me any pain, it hasn't gotten worse. So I believe that the bunion is stabilized, because for me, it don't seem like it deviated. It's not more deviated than what it was. And it's not giving me increased pain right now. So I hope that answered your question. The bunion is stabilized. I don't look forward to getting bunion surgery like anytime soon, by the grace of God. If I do continue to, if I have pain, and if it's like a continual kind of pain, I will first continue to use the bunion correctors, or they even have different types of bunion correctors that you can put on your foot, like get it from Amazon. I would most likely try those first before I get surgery again. Surgery is like my last option. But also, as I'm speaking to you guys right now, I'm thinking like it's probably better to correct it now before it get even worse, right? But I'm just being honest of where I'm at right now, and what I'm doing right now is that I'm okay. It hasn't been giving me any pain recently, or I'll say within the last year, I haven't had any pain where the bunion is. And the next question is, are you able to wear any type of shoes now? So yes, I say that with a little bit of hesitation, because I'm still not able to wear really, really flat shoes with no arch support. Whereas before my surgery, you know those really flat sandals that literally have nothing, no support, nothing. Before my surgery, I was able to wear those. But now I have to have some kind of arch support in my shoes. But I'm able to go to a store, buy a pair of shoes without getting any alterations, without adding any extra inserts to the shoe. So I would say I'm back to wearing regular shoes that I would wear, and the flat shoes, that's not really a big deal for me. Now for heels, I never really wore heels too much before the surgery, only when I was younger, when I was in like a little modeling group thing. But as for my day-to-day and regular, like just daily life, I'm not really a heel person. So I don't wear heels now. Now I could wear like a little block heel, but as for like high heels, I don't wear them anyway. So I'm sorry, I can't really speak on like if I'm still able to wear heels after the surgery. I feel like I could probably wear heels if it has some kind of like cushion or arch support in the shoe. So I'm going to give you guys an example of a shoe that I can wear now that I was not able to wear 6 months post-op, okay? So this is a flat shoe. I know I said I couldn't wear really flat shoes, but I'm gonna show you guys in a minute. So this is considered a flat shoe. This is a shoe that I can wear now comfortably, with no type of issues. It's comfortable. I don't have pain when I wear these shoes. But let me show you guys. This shoe has a little bit of cushion going along. Even though it's a really flat shoe, it has cushion. And I don't know if you guys can see that. It has an arch support in the shoe. So I can wear these with no issue, like for hours, no issue, no foot pain. And this is, I would consider like a regular shoe because I didn't have to add any type of insert in my shoe to adjust it to my foot. So this is an example, and this one is really comfortable. It's incline eye flex. If you're ladies, if you're looking for like a comfortable flat shoe to wear to church or work or whatever. So yeah, I would say I'm back to wearing regular shoes. For tennis shoes, I have other tennis shoes. I could wear regular tennis shoes without any, again, no inserts. For my walking tennis shoes where I will walk, I wear Skechers, and those have been just really good for my feet. I don't have, for the most part, I ain't gonna say perfect, nothing's 100%, but I don't have any issues walking like hours just walking with those tennis shoes. So yes, I am able to wear tennis shoes or shoes, any type of shoe that I would wear. So I think that was it for all the questions that I had. Again, if you have any questions that I did not answer and that you want answered, please put them in the comments or send me an email. All right, so now I'm going to get into the update. So I'm going to try to insert, as appropriate, insert either pictures or videos of, to give you guys a visual of how my foot is now. I am like a visual person, so that helps me, and also it will help you guys like to compare to the other videos that I made during my recovery. So the first thing I'm going to talk on is strength. So I will say that the strength in my toe or the strength in my foot is better than it was 6 months post-op, as one would hope, right? You would hope 5 years later you're like stronger, but sometimes that could not possibly be the case. So I'm just grateful to God that my foot is strong. So I think I told you guys that in the video, what helped me to determine strength in my foot is if I'm able to do calf raises or stand on my tippy toes. And I was able to do that in a 6-month post-op video. But I said like a true test for me, for example, would be if I was able to do a calf raise on one leg without any issues or without any pain. So I'm going to insert a video right here. All right, you guys, so I have a different setup and I'm trying to find like where I can show you guys. Like, I know it looked kind of far away, but I want to show you like with strength. Of course, I could do, like I'm barefoot, I could do the calf raises, and this is a hard floor with no pain, no issues. Of course, I guess as you would probably expect 5 years later. But so this is my non-surgical leg, and I'm going to try to do a calf raise on one foot. I can do that, no issue. I'm going to try to do it on my other foot, but yeah, so I can do it. No issues, but it is a little bit more stiffer than the left leg. So it's not as steady, but like I said, as long as I can function and do what I need to do, it's all good. Okay, so right now another test of strength is like I'm gonna do like a jump squat, and I'm barefoot right now. So of course in tennis shoes it's okay, but also I want to say, I mentioned I had knee therapy for my knee, and when she had me do the jump squats, like when I had to do multiple, I did started to have a little bit of pain in that foot, and thank God it resolved. But yeah, like I said, it's like flare-ups and it resolved. But jump squats is not something that I would usually do, so I'm not really that concerned about it. But I'm gonna do a jump squat right now, and to show you that I could do that, which is something that I would not be able to do 6 months post-op. Just to give you guys an example. So yeah, I was barefoot in the video. I was able to do calf raises, and another strength test for me was like doing jump squats without any pain. Now, when I had to go to physical therapy for my right knee. I had a cyst and bruising in my right knee, so I had to go to physical therapy to strengthen the muscles around that knee. And one of the activities or the exercises that she wanted me to do once I got to that level was to do jump squats. And I noticed, like, when I did like a lot of jump squats, or by the repetition of jump squats, I started to experience some achiness in my foot. So right now I'm able to do them, but with tennis shoes. In the video I showed you guys, it's I'm barefoot doing that. But with tennis shoes, even when I was doing with tennis shoes, if I do like a lot of them, I start to realize I started to have some kind of achiness in that foot. And thank God, like I said, when I rested, just stop the activity for a little minute, then it resolves and I'm able to go ahead and do what I need to do. And when the pain resolves, I'm able to do what I once did. Like, that's things that are important to me and that help keep me active. I'm able to do it. And if I need to rest, and then if I need to take a day off of exercising, or even a couple of days off of exercising, if I notice pain in my foot or achiness or whatever it might be, or stiffness, I just kind of listen to my body. And I think that's like another tip, and that kind of helped me mentally too, is to try not to become frustrated of if it's something that, like, for example, if I just went dancing, right, and I started having achiness in my foot, instead of trying to push myself to keep dancing, or instead of trying to push myself to like dance the next day and different things like that, what's important for me now is to kind of just listen to my body. And if I'm having achiness from doing something, then I need to like kind of just take a chill pill for a minute and just listen to my body, and not feel so frustrated that I'm not able to do that right now. I don't know if that makes sense. It makes sense in my head. But the key point is to listen to your body, because it was a change that happened, and my foot is missing a bone. So it's not going to be exactly like it was before I had the surgery. And just that acceptance of that, and there is that fear there that can develop of like, what if this happens again? And I feel like I'm still working through that, like, by the grace of God, like, help just working through that fear. And really, I need to continue to pray and ask God to help me to work through that fear of like, what if I break the other bone in the foot, or what if I do something and that causes me more pain? Like, that's something that I'm transparently still kind of dealing with. But the whole accepting that, okay, it's okay to take a break. It's okay to rest your foot. It's okay to rest your body right now if you need to. Like, listen to your body. So that's another point that I just want to make. Like, that helps me a lot during this journey. Yeah, so kind of seeing it as like a journey, and seeing it as this is part of my story right now, that even though I'm not 100%, I'm not where I used to be, and I could continue to progress forward, and that I'm better than I was. So just seeing it as a journey, because it was a change that was made in my body, and my body is not going to be 100% where it was before. And we just, with aging, it's a journey. Like, you got to do things different, or just adapt and modify activities a bit. But as long as I can participate, yeah. So the next thing I'm going to talk on is flexibility, and I kind of touched on that a little bit earlier, is that I don't have full range of motion in that toe, and it's because I didn't do what I need to do. And I wonder if the outcome, it probably would have been different if I would have really pushed to stretch that scar tissue out. But I also have to consider that before I got the surgery, and I mentioned this in another video, that I was in a boot for 7 to 8 months. You guys, I was in a boot for like 7 months. So my toe was already stiff. I done already lost some kind of range of motion just being in that boot. And so I kind of take that into consideration, that all that factors in of why I don't have full range of motion. But even if I don't have full range of motion, like I said, as long as I can participate and function and engage in meaningful activity, I'm good, right? Yeah, so I'm going to insert a video right here of the flexibility of my foot. Show you guys like the flexibility, what I'm talking about. I don't have range of motion, full range of motion in that toe. So this way, I think this is extension. When I'm extending my toe, it's basically, I have the full range of motion there. It's almost exactly the same as my left foot, but when I flex it, so this is the non-surgical foot, that's how much I could flex it, and this is the surgical foot. So as you guys can see, it's gotten better, I think, but it's just not, I don't have full range of motion. And I don't even know if it has something to do with the incision being like lateral like this, like along the big toe, but that's neither here nor there right now. But yeah, I'm able to flex it, but it's not too bad, but it's not full, like as you see, like this part, if I push it down, it can go down, but not on its own. And I still have the scar. So along with me not stretching, I'm just being honest with you guys, along with me not stretching that that toe like I should, I was not consistent in putting like either cocoa butter, or like someone suggested like I think it's called Mederma, I don't know if I'm pronouncing it right, and I bought it and I did it, but I was not consistent with it. So I still have that scar, if you guys can see, like, and it's a pretty long scar. And so stretching would definitely help loosen up that tendon, and it would help with pain too. So I probably do need to get back into just being more consistent, or just mindful of like stretching out this tendon right here, to decrease any further occurrence of like pain or tightness and stiffness. So I still have some stiffness because I haven't been stretching it, like I said. Okay, I hope that give you guys, sorry about my feet, you guys, but I hope they give you guys like an idea. So the next thing that I'm going to talk on is activity tolerance. Now, activity tolerance I consider for me, how I gauge activity tolerance, one way is through work. Like I said, I mentioned already that I'm able to return to full-time work of what I did before that required me to be on my feet almost all day. And I'm able to return to that. I'm not hindered anymore by my foot from working. So I'm able to tolerate that activity that I once did. And so to me, that's my activity tolerance has improved. Like I said, I'm able to walk for an hour or more than an hour if I need to without any issues most times. I'm not going to say 100%, but most times. And I'm able to do exercises. Like I said, high impact jumping, I can do it, but sometimes it's just, sometimes I don't have issues with it, and then sometimes I do have a little bit of pain, and then that just tells me that I did too much and I need to rest and I need to just regroup. So yeah, activity tolerance, basically I feel like I'm almost back to my baseline, because baseline I did not have any pain in my foot. I could dance for hours. I could do, like, I didn't have any pain with any activity. But the reason why I say 85% is because sometimes I do have flare-ups of pain. It's not every day, thank God, but it is sometimes flare-ups of pain. I don't know if arthritis has developed in that foot, or I don't know, but thank God that it resolves with rest and conservative treatment. The next thing is balance. So with balance, my balance wasn't too bad in a 6 months post-op video. So my balance now is, I would say, it improved, but I'm able to do what I need to do without falling, or if I need to reach something without falling, or even when I danced at um my aunt's funeral barefoot, like turning and everything, I was able to do that without falling by the grace of God. And even when I exercise or do different balance activities, when you do, like, when you do the standing core activities and everything, I'm pretty much okay. Not saying my balance can't improve. I feel like I can improve on my balance, but I don't think it's because of that, of my foot no longer. My foot, I don't think my foot is the issue right now, if that makes sense. So balance, I would say my balance is pretty good as it can be, but I can always improve upon my balance. And the next thing is swelling. So I really don't get too much swelling. I would say, I would even say it's less than occasional if I get swelling in my foot. I, not to say I didn't have swelling within those 4 years of recovery. I did. More towards, like, in the beginning, I did have occasional flare-ups of, like, swelling, but with ice and elevation and rest, like, I was okay. Once I pay attention to it and know that if my foot is swollen, then I try to, like, take something, or like ibuprofen, or do something to try to reduce the swelling before it get worse. But I don't have any swelling in my feet right now, and I'm pretty okay with swelling. Right now, 5 years later, don't have swelling again. Like I said, like, yeah, thank God I don't really have swelling. And pain, the pain is, I want to say occasional, if that makes sense. It's kind of hard to gauge it, because I want to say, and I don't have a sharp pain, it's more just like an ache. Like, even in my knee, even in my right knee, I don't have pain every day. Even though I went to physical therapy for it, I don't have pain every day, but I still have that occasional flare up of pain, like, my knee is hurting, or I might have done too much and my knee hurts. So it's kind of like one of those kind of things where it's like, one day I can have no pain at all. The next day I could wake up with an ache in my foot, and that's like occasionally. I'll wake up with an ache, or I don't know if it's maybe something that I've done the day before, or, but I want to tell you guys, like, to be honest with you guys, I'm not 100% pain free. 100% pain free for me would be that I never, like, have experienced pain now. And that's just not the truth. That's just not my truth right now, is that I do have occasional flare-ups of pain. And yeah, and I just learned to kind of, I don't know if this is good, but just kind of accept it, like the pain is not unbearable. It's more like an achiness, like I said. And that's just telling me like I need to try to figure out the point of where the pain is coming from and try to do things to decrease the pain. But by the grace of God, like I said, when I do have those flare-ups, like they kind of dissolve on their, not on, yeah, on their own. I pray about it. I pray on my foot, over my foot. I'm like, Lord, please bless me not to injure this foot again. Like, please bless this pain to go away. I pray about it, and I just keep moving forward. And mental health, and I touched on it already, but I feel like just seeing, just accepting that I might have occasional flare up of pain, just accepting that, okay, if jumping up and down is causing me issues, just don't jump. Like, is that really going to impact me jumping? Me not being able to jump is not going to impact my health in any, it's not a significant impact on my daily activity and what I like to do. Um, I just try to think of it in that way, depending on what it is. Like, and if I need to modify what I'm doing, I just kind of like try to modify it, if that makes sense. So that's been helping me, is accepting and understanding that it's a journey, and that it's okay that that I'm not where I was before my surgery, because things change. I'm not the same person that I was a couple years ago. So just accepting that, things can be different in different seasons, and I just keep praying, asking God to help me to continue to progress forward. But I do want to say that God is so gracious and God is so kind. And what this experience has shown me is that He has brought me through. Each day that I wake up, He's brought me through. And it's some things that we thought that we could never get over, that we would never, like, it would never go away. But it's like He's brought me through. When I had to go through that surgery, that first day when I came from the hospital, I didn't know how long the recovery process was going to be. And I didn't know, kind of what to expect, because I had false expectations. They told me I would be back to work in like a month, and that was not the truth. That was not the truth. But it shows me like God bless me to be able to return to work, to be able to return to things that I like to do and not have pain, and be able to do it as if, that I was not able to do it when I first had the surgery. So it's like it just showed me that God is faithful, and He's a healer, and He blessed me to make it through. Like, it's just like He brings you through. Each time you wake up in the morning, he brought you through something. He brought you through another day. Like, it's a brand new day, and it's not always easy. Like, when my aunt passed, like, I couldn't imagine just living without my aunt. I was so close to her. But it's like He brought me through that. I'm still here, and I can talk about her without crying. Like, that's, God brought me through. He brings you through. And so I hope this video encouraged you to keep progressing, keep moving, keep accepting, keep praying, keep going. And I hope that your recovery is continuing to be fruitful, and that you'll be completely healed in Jesus' name, and that He'll completely continue to heal my foot in Jesus' name, and bless me with the grace to continue to move forward. And so, yeah, I hope this video helps. Again, I apologize that the video is kind of a little bit long, and I apologize that it's been so long since I've done an update for you guys. But yeah, thank God for His grace, and I just hope that it blesses you all. I hope that it helps bring some hope that I'm not where I used to be 5 years ago, and I'm able to do what I need to do by the grace of God, by His grace, and by His grace that He uses things to humble us, right? Because, yeah, I know that it's only by His grace. So yeah, all right, you guys. I can keep going, but I'm going to end the video right here. And I pray that you guys stay blessed. All right, bye.